I will start with the background. Yeah, this is our background of our research. That adolescent pregnant mothers can potentially have a problem related to their immature physical and psychology conditions. Uh, then, their healthcare seeking practice is essential to ensure that adolescent pregnant mothers receive adequate care during their pregnancy. Furthermore, during COVID-19 pandemic, there are obstacles for getting health services, especially for adolescents pregnant. Online media should be perceived as an alternative way to help adolescents seek care during pregnancy. Thus, we try to explore the experience of pregnant adolescents mothers who had practiced healthcare seeking and followed online counseling using WhatsApp group. Okay, this is the method of our study. Yes, actually, the midwife delivered online counseling through WhatsApp group for about 2 months. So we have created a WhatsApp group, namely Ibu Hamil Remaja Sehat ya, for Indonesia adolescent pregnant mother. And then the group contains of more than 100 mothers. Then the themes of counseling is based on the problem faced by pregnant mother in this group. And then to keep confidential in this group, mothers can do private chat if they want to ask something that private. They can do direct message for me as a midwife. Then the midwife and the member in this group also not allowed to share everything that confidential in this group to those that are not member in this group. And then this is a qualitative study. They created 16 Indonesian pregnant mothers aged 15 to 19 who had followed WhatsApp online counseling. Then we collected data using an open-ended questionnaire. Then the data were analyzed using thematic content analysis. Here the open-ended questions. There are 7 open-ended questions that we had used in this research. From number 1 and the number 7. Tell us about your experience and then the benefits, and then what makes you enthusiastic about consulting via WhatsApp, and then how are your advice so we can deliver better counseling in the future, and many more. And then here's the demographic profile of participant. The number of participant is 16. Yes, we collected 16 from 100 member in this group. The age rank between 17 and 19, and the gestation age between 16 and 39. Okay, and here are the findings. Actually, there are 4 main themes of this qualitative study, namely experiences, benefits, motivating factors, and advice and hopes. So the other main themes. Also, there are various themes here, and I will describe one by one of each themes. The first theme is about experience. Pleasant experience. Most mothers feel happy, easy, interesting, helpful, and comfortable during following the WhatsApp consultations. We can see on the statement delivered by mother here, by the pregnant mother here. I wanna read one of the statement because lot of statement here. Okay, I will try to read it here. Very helpful and very happy because there is an online consultation using WhatsApp. It makes it easier for me when I have problems during pregnancy. I just consult through a private group or chat. Then if we as midwife find that there are problems that adolescent pregnant should follow up the further examination, we recommend them to go to clinic or the public health center near them. So WhatsApp group, the consultation in WhatsApp group, useful to early detection and also early early prevention for the next risk for mother. And then previous experience. Most mother said that they never get online counseling before. We can see it here. I've never been before, and this is my first time joining a teenage pregnant group. Usually I did private chat with midwife, and then if the problem is not getting better, I went directly to the clinic. It means that previously midwife conduct the counseling using WhatsApp group, then can be useful for the maybe the WhatsApp group only for communications related to maybe information about the time schedule of antenatal care in the public health service, and also maybe yeah, important information about that. But there is no consultation in the WhatsApp group. Then here the hindering factors, yeah. The biggest obstacle is when they are didn't get internet connection, yeah, because we understand that Indonesia is a very large area, and most of our area is in the village, yeah, in the village or in the rural area, and then in the rural area, and the internet connection sometimes is a big problem for us. Okay. Then the benefits of online counseling. Yeah, actually there are a lot of benefits of online counseling using WhatsApp group. First of all, it's about the expand knowledge and experience. We can see there is a lot of experience stated by the mothers. Yeah, I will try to read one of them. I can understand which ones are good for pregnant women, which are not good for pregnant women. I also understand which ones need to be avoided for pregnant women. Yeah, this is for example, yeah. And then I understand more about the correct or healthy pregnancy period for pregnant women with teenagers. So we know that teenager is really young people, yeah, below 20 years, and they are have lack experience, they are lack of knowledge. So providing online counseling using WhatsApp is beneficial for them. Okay. The further benefits for them, yeah, we can see here so many, yeah. There are so many benefits about pregnancy. My knowledge is improved by by participating in WhatsApp counseling groups. I can expand knowledge about pregnancy, especially at my age, which is still a teenager. I get more insight about pregnancy. Yeah, hey, I think it is interesting, yeah, for us to do more for adolescents pregnant. Okay, then here the benefits of counseling, yeah. Have full, effective, efficient, and easy counseling. There are a lot of information here. It is easier to use it than to consult directly. Sometimes it's hard to explain my complaint when I arrived in clinic. I confuse how to deliver it. By texting in WhatsApp, it is easier for me to tell my complaints. So it is also a new insight for me. Yeah? In fact, not all mother can speak directly with a midwife or with the doctor in the clinic. So they are prefer to use texting, yeah, was using texting messenger to tell what they are going to complain. Yeah, I mean that their problem, maybe they complain. It very easier for them to type, yeah, using WhatsApp messenger. Okay, and then the other benefits here. This is very helpful for me personally because I'm pregnant for the first time. So I can ask questions in the WhatsApp group. You know that the question sometimes it yeah, general question, yeah, general question about the such as morning sickness, yeah, yes, such as a very general question for pregnant women. But it is really essential for them because as I said before, that adolescents generally they are lack of knowledge, yeah, before. And then here also the benefits of peer groups, yeah, peer WhatsApp groups. First of all is broadening relations. By joining the WhatsApp group, they can meet each other. Yeah, we can see. For me, of course, it is more fun, more comfortable, and can add many friends. And also, of course, yeah, their friends also the pregnant, so they can share experience with each other. I can ask question about the pregnancy to teenage mother, to the teenage pregnant women in this group. I also can answer the question I know. We can share each other, know each other, and encourage each other. It's interesting, yeah, for me as a midwife. Okay. And then we also got the information here that the other benefit is by following a peer group, yeah, adolescents WhatsApp group. Yeah, they said that I can be more knowledgeable. I'm pregnant for the first time. So I want to know more about pregnancy. From this group, I know about pregnancy. So it's easier to know about that. Yeah, about it. Yeah. I can find out what are the complaints felt by other teenage pregnant women, even though it doesn't happen to me. It is also interesting, yeah. So adolescent can learn more from the experience of other mother. here, here is the motivating factor, yeah, motivating factor. Actually, the midwife in this group, the midwife should be a friendly and responsive mother. Should be friendly and responsive midwife, because by our attitude, good attitude, by our responsive and then friendly, the adolescents will comfortable in this group. Yeah, will be comfortable in this group, and they will ask more and will tell more about their condition. And I think it is important to prevent the further complication among adolescents, pregnant mother. Okay. And about the suggestion to the next consultation, they said that most of them said that no suggestion, because they feel that it is enough for us. It is really helpful, yeah. So far, midwife must ask for question. Okay. So far, it still can give advice to midwife, because when I'm in the group, I feel comfortable and haven't found anything bad in the group. I don't think so, because it has been very helpful, because the midwife always ensure the compliance of pregnant women. Yeah, if we have to spend a lot of time, actually I also have spent a lot of time to make a consultation with them, yeah, and also try to be a responsive midwife in here in this group, yeah. Okay, and then it is also the advice from them: be polite, can be consistent, and can be duplicated by village midwife. It means that yeah, mother said that they hope the village midwife can be like this. I mean that the village midwife can provide a WhatsApp group, yeah, content of among adolescents, pregnant women, so they can share experience each other, and then they can get more knowledge, yeah, get more insight from this group. Okay, and then yeah, my advice is that midwife must be online. Yeah, okay, it is advice. Yeah, there are several advice here, but I will not read all of the advice. Yeah, okay. Then we go to discussions. Yeah. During COVID-19 pandemic, people prefer to stay at home due to afraid of contracting COVID-19, including adolescents. And it, yeah, leads to lack of antenatal care. Okay. Geographical landscape, being far with public health center, cultural and social belief. We know that in Indonesia, yeah, we also we believe there are a social belief that adolescents pregnancy, yeah, especially those with unmarried pregnancy, it's so bad, yeah. So it is also be obstacle for adolescents. Sometimes they seem to go to a clinic, yeah, go to clinic to take antenatal care. Then this also improve the like antenatal care among adolescents. Adolescents' pregnancy still young, mostly on their first pregnancy, no experience before. Need more help and suggestion as part of their healthcare seeking practice and to prevent risk. Then, online counseling improved the chance for adolescents to practice healthcare seeking during their pregnancy amid the COVID-19 pandemic. It improved the maternal well-being and mother-to-infant bonding. Most of pregnant say that they have not received any online counseling before. So it should be noticed, yeah, that midwife, yeah, midwife, maybe other healthcare provider also can provide online counseling, yeah, because they also need online counseling. This study indicates that online counseling trigger adolescents to make consultation freely if they have a pregnant complaint during pregnancy, might reduce the developing of complaint to complication. Yeah, it is important because we have to prevent, yeah, preventive measurement. So by providing online consultation, we can reduce the developing of complaint to complications. Then was a group content of adolescent pregnant. Yeah, this is also a peer support group. This give positive impact. They can share experience each other. They can give knowledge each other. Yeah, something like that. Okay. Adolescents feel happy and comfortable, and it improve well-being and their confidence as a new mother. Yeah, confidence is important, yeah, for new mother, because we can the better confidence. I mean, will be the better confidence, the greater, yeah, the chance to be a successful mother in the future. And then to But no least, suggestion, healthcare providers, especially midwife, can provide WhatsApp group and online counseling as the part of their care. After online counseling, the patient can be invited to the clinic. Is there any need for further examinations? Here, my references, actually, there are a lot of references, but I also mentioned 5 here. Okay. I think this is all my presentation. Thank you for the chance. Assalamualaikum warahmatullahi wabarakatuh.